Have you ever struggled while you're suturing? Well, if you haven't, this video is definitely not for you.
Hey, I'm Ash from All Things Dentistry, the place where we're passionate about sharing those unwritten hints and tips of dentistry. Hey, I'm Ash from All Things Dentistry, the place where we're passionate about sharing those unwritten hints and tips in dentistry.
This surgery is a root resection from a maxillary molar, and there are a few incision and suturing tips that I wanted to share with you. Stick around until the end of the video to see the tip that truly changed the game for me in surgery. You know, if you're new here, take a look around and don't forget to subscribe if you want to see more tips about dentistry. There's a suturing link in the description box below that goes over some great material. Let's jump into it.
All right, tip number 1. I was taught by my friend and oral surgeon, Dr. Lee, to use the 15 blade at an angle interproximally to sever the periodontal fibers in the papilla before you try to elevate it. You can use the blade upside down, which actually may prevent cutting the free gingival margin, which then prevents it from tearing, of course. Or you can use it right side up. I mean, whatever your fancy is. But I'll be honest, this tip makes it so much easier to elevate that papilla. Tip number 2, when doing more posterior work like extractions, I find it unnecessary to make sulcular buccal incisions with a 15 blade. I find I just end up nicking the free gingival margin along where I'm trying to incise, which then increases the possibility of the flap tearing over the course of the procedure. I decided to use a releasing incision from the mesial portion of tooth number 1-5. I use this releasing incision to help increase my visibility for the procedure. Tooth number 1-7 is an implant, so I wanted to leave all the periodontal tissue intact and not elevate the 1-7 gingiva. Thus, the only way to get access to the distal buccal root of the 1-6 was to release the mucosa anterior to it. Okay, so that leads me to tip number 3. Make sure you can see what you're doing, especially when you're doing surgery. If you're new at pushing gingiva away, make a larger flap than you actually think you need. Tip number 4, keep your retractor on bone. I've been taught over and over and over to keep that Minnesota retractor or whatever retractor you're using on bone. It's so easy to tear the mucosa, especially if you're just learning to do this. Keep it on bone, that way it will keep the soft tissues out of the way and you won't damage the soft tissues with your retractor or any other type of instrument. Okay, so we're just going to remove that distal buccal root from tooth number 1-6, and then we're going to do lots of saline rinse. Tip number 5, it has been drilled into me to irrigate underneath the flap. We always want to irrigate the extraction socket, but I can tell you there's so many little trinkets of debris hiding underneath that flap that you really have to take your saline rinse and irrigate copiously underneath that flap. Tip number 6, suture from unattached mucosa to attached mucosa. Just like in the video here. Trust me, I've tried it backwards, forwards, anyways, and it's so much more difficult to go attached to unattached. Tip number 7, start suturing with the releasing incision versus the remainder of the flap. Again, just like in the video here. And I've tried it many times the other way around or forgotten I had a releasing incision and done it the other way. And honestly, it's just like starting a sweater, a button-up sweater on the wrong button. You get all the way to the end and you're like, oh, the lines and the buttons and holes are mismatched, so you got to start again, and that's the same with suturing. Tip number 8, I'm just using Dexter here. So have your dental assistant, when you're starting to suture and just about ready to start throwing some throws, have your dental assistant bring their right hand around the top of the patient and then hold your Minnesota retractor. So this frees up one of your hands. It doesn't have to hold a retractor, and you can tie the knot as it needs to be tied. And then in the right hand of the dental assistant is the retractor, and in their left hand are the scissors. So when it's time to cut the suture, cut the tails of the suture, they're ready to go. Tip number 9, my buddy taught me this many years ago. So I'm going to use a large enough needle to go between the buccal and the palatal side. And I asked my dental assistant, did it pass through the gingiva? And she's like, yes. So if it does, what I can do is I can back that needle right through the embrasure underneath the contact, and that's it. And then I can tie my knot. That tip right there has saved me hours. Let's watch that again. And finally, tip number 10, go slow, my last tip. For some unknown reason, suturing seems to be the most difficult phase of surgery. I don't know if it's because it's at the end of the procedure, you're tired, or you're just trying to fiddle around with really difficult materials that when they get wet are slippery and turn wet noodle-like. Take your time and do it correctly. So the patient came in just as I was about to release this video, so I was like, oh, I need to put this in. So we're at 1 week post-op. We're going to remove some sutures, and you can see, apart from the screaming red irritation from the vicryl and the more vestibule portion of the tissue, everything looks to be healing very nicely. And now we remove the suture, and honestly, just like my mentor, my perio mentor many years ago said, that the tissues look like Valentine's Day. Beautiful and pink.
So thank you so much for joining me. I'm super grateful you're here. Let me know if any of these tips have helped you, and if you have any others. I'd love to try them out and share them with others as well. We'll see you soon.
Okay. All right, let's open it up. There's one more here.
I knew it.